Practice management is all the things to get if you decide to branch out on your own, which is great because there's autonomy and you can make as much as you want as long as you're creative. And, we're hardworking to start with anyway. But so as long as you're willing to put in the work, I think it can be very lucrative. Obviously, we go into this with a heart of service, so that is not the issue. But I just want to make it clear that not only are we here to serve well, but we're here to earn well. And that's what I've been working on.
The IMG Roadmap is the only podcast dedicated to coaching international medical graduates in success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams. Hey everyone, welcome to another episode of the IMG Roadmap podcast. Today's guest is Dr. Ngozi Ude-Oshiyoye. She's a family medicine physician, board certified out of Martinsburg, West Virginia. She's affiliated with the Berkeley Medical Center in the area, and she's also a private practice owner. And the reason I invited her on the podcast today is because I want us to go take a deep dive into family medicine and your options within family medicine. Because so many of us are thinking, first of all, there's been a wave lately. Many of us did family medicine because we thought it was the safety net, the backup plan. And then you find yourself now in a career that you still have to develop. You still love being a doctor, but you just feel a little bit stuck. So this episode's for you. Dr. Ngozi, welcome to the show and tell us a little bit about who you are, where you're calling from, and we'll dive into it.
Yay. Thank you so much for having me. It's such a pleasure to be here. So just to introduce myself, I'm Dr. Ude. I'm a board certified family medicine physician. I co-own a primary care practice, namely Apple Valley Family Medicine. And our goal is to basically serve our patients well. And in that process, on purpose, have them not only feeling good, but looking good. And I think this topic, I think, is really, really important because I think in this season, I think things are really, I would say, difficult in the physician space. But I am a proponent of, we literally have the power in our hands and we have a lot of tools. We're super smart. We can do anything we put our minds to. And I think it's just more of owning that and knowing what we're worth and knowing what our options are, which I would say, I can speak for family medicine because I'm in family medicine, is limitless. We see all age groups, pediatrics, adult, even going into the aesthetic space if you choose to. And then a big one is practice management, so entrepreneurship, and the list goes on and on and on.
Yeah, I think that the list is super long for what our options are, but we're not told enough about this in residency. I also completed a family medicine residency, I think it was 2015. And I don't remember, hearing about all these different options for me. Just to kind of take a recap, before we go into sort of our individual, maybe more unique stories, especially yours, I really want to dive into what you do, the services you offer, because I feel like people need to know, especially residents or newly minted family medicine physicians who are coming out to the workforce and they're like, now what do I do? I don't just want to have a cookie cutter practice, or I don't want to work for the academic center. I want options. Or maybe some of them are like us. They have that spark in their eyes. They love business or the business side of medicine, and they still love being great physicians, but they're looking at how do I utilize my degree to the best extent of it. So, first, I just want to go over some of what P and ABFM puts out for as options within family medicine. Family medicine is a 3-year residency program. It is not internal medicine, right? The main things that make us different is we can do pediatrics in training. We do some maternal health obstetrics in training, and we primarily focus on not only outpatient, but outpatient and inpatient care. Those are the big things in our specialty. When it comes to fellowship options, we have options for sports medicine, geriatrics, allergy immunology, I'm blanking out, emergency medicine, hospice palliative care, and there may be one more that I may have forgotten. However, I feel like even amongst us, we don't even talk about those options. And fellowship's not mandatory for everybody, but that's just putting that out there, clear cut. That's kind of known information. Now, let's take a deep dive into your career path. How did you, give me a little bit of insight as to finishing residency and where you're at today? Like, what are the things you have tried, right? Have you tried a little bit of clinic, a little bit of being employed, I'm sure it just didn't happen overnight. So give us a little bit of perspective as to what all you've tried and tested out in family medicine.
So I just wanted to start by saying with family medicine, the sky is the limit because, we see all age groups. So when I even advertise for my practice, it's 0 to 99 and beyond. So everything that you listed is a possibility for us. And that's the beautiful thing with family medicine. So for me, I graduated residency in 2011. I started an employed position. And I realized quickly that it wasn't going to be what I wanted fully long term. I think what it was I didn't like the lack of autonomy, and a lot of things were changing. I guess before we started formally, we were talking about, the lack of, at least for me, I think the lack of training with things like coding and practice management. And so sometimes it can be scary when you're thinking about other options and you don't feel equipped. But this is not something that is that difficult to get the training. Now, I will say this, that I think that residency programs, even medical schools, need to inject that into our training where they're, focusing on coding, because coding is very important. That's the way when you're accepting insurance, you're able to maximize and get paid. And then obviously practice management is all the things to get, if you decide to branch out on your own, which is great because there's autonomy and you can make as much as you want as long as you're creative. And, we're hardworking to start with anyway. But so as long as you're willing to put in the work, I think it can be very lucrative. Obviously, we go into this with a heart of service, so that is not the issue. But I just want to make it clear that, not only are we here to serve well, but we're here to earn well. And that's what I've been working on. So once I got out of the employed position, then I and my husband created our practice together. It's been up and running since 2016. It's definitely been a journey. So it's not easy, but it's definitely doable. I think in this climate, it's been very difficult, I think, in the physician space, because I don't feel like we're well appreciated. I don't feel like our education is well appreciated. And I don't think that we were equipped enough, or at least maybe not told that, assured or cultivated that feeling of you're worth it. And so anybody that is listening, you are worth it. You're well trained. And I remember this quote that said, there's somebody that is less trained than you doing what you want to do. And I don't know what the exact thing is. So trust me, whatever it is you want to do, you can. So anyway, going back to the timelines, we started the practice and it's been going very well. So I think what it was eventually what I realized was I needed to branch out and talk to other people and learn. And so what I ended up doing was I started in the physician space, connecting with people that were going where I wanted to go, which was to scale my primary care practice. I even branched into aesthetics. So that's even another field that you can get into, get trained for it and all that. But the bread and butter for me is practice management. And then obviously entrepreneurship. There's another branch where you could do real estate, you could invest. So if you like academic medicine, you can do that as well. But the main thing I want to say is don't do just one thing. I feel like you want to have multiple streams of income. And I feel like with our training and with our exposure, I feel like a lot of physicians feel like it's only medicine we can do. And that is not the case. We can do whatever we put our minds to. I think we just need to get out there, talk to other people. The other thing is also we need to band together, because a lot of the things that are happening in the physician space, I think we're not getting enough lobbying. We're not, connecting with each other, I think, as much as we could, and helping each other as much as we can. I think that could be better. So, and that's that. I would say currently, my practice is scaling. We're doing very well. I usually say the reward for solving problems is more problems. So we're expanding and we're figuring out ways to solve the problem, which is serving our patients well and definitely making sure that we're earning well.
I love it. Absolutely love it. And there's so many things I want to follow up on based on what you said. I particularly appreciated when you said there's unqualified or less qualified folk doing the things that some of us physicians are worried about doing or concerned about doing, or whatever word we want to use there.
Yep.
But it reminds me of what I have witnessed even as a physician. And I've been to a practice maybe run by a mid-level provider, and I have nothing against mid-level providers. Love them, work with them. I even visit some of them as for my own personal services from time to time. So, but I've seen work that has been put forward by mid-level providers that supersedes work that I know some physicians can offer. And that's in the entrepreneurial space, whether it's practice owners, whether in the aesthetics market. And they go at lengths to get whatever it takes to get the training that we so freely received.
Right.
And we are able to grasp an even more in-depth understanding for some of these things. And it just always baffles me how I'm like, man, and I've left those practices sometimes thinking, why don't I have an aesthetic practice? Or why don't I have a weight loss practice? And it's not that I can't do it. I just maybe need a CME here and there, some training, come shadow another physician like you, or whatever the case may be. And I should be good to go because the material is easily digestible, easily understandable. But I just don't know if, I think maybe in residency, we were all indoctrinated into it must look a certain way. It must be this cookie cutter. And, I love the resources that the AFP puts out for us. And I just want to list out some career options in family medicine as per the AFP. They have direct primary care, which is where the physician is directly involved with the patient, usually not using insurance, but there are other options for the patient to still have insurance for other purposes. There's employed status, which you said you did for a couple of years before going into your private practice. And within employed status, you could be employed by a hospital, a community health center, or the FQHCs, or a multi-specialty group. So depending on what kind of employed status, there are options within that. And then you could do part-time work if you want to do part-time work, or you could do full-time work. You could do role practice. There are other focus areas like we mentioned earlier on, but I forgot to mention wilderness medicine, international medicine, research, public health, maternity care, also as a fellowship option, education. So for those who are interested in being professors, clerkship directors, deans, you have that option as well of those fellowships. Now, for those that are not interested in fellowship, then maybe you are set on private practice like we're discussing here today. And I want us to kind of dive into a little bit more about establishing your private practice, how you did it, where you're at now. You mentioned the practice is thriving, and we love that. But we want to know more. Like, is this a 5-bed practice? Is it 10? What does it look like when we walk in? How many providers or physicians are you working with or alongside of? What is the patient population as far as like numbers? And where did you start? And how has that been going for you?
Gotcha. And I just wanted to complete that quote. And there are people out there less qualified than you doing what you want to do. The only difference is they choose to believe in themselves. And so that was the full quote. But so primary care, we started from scratch. What we did, a lot of the things that I think that is part of the core that is very, very important when you're starting a new business or practice or whatever is sales and marketing. So sales is just asking and asking and asking. So sales is asking, and then marketing is making yourself more visible. So something like this, like the podcast, when you release it, this is a form of marketing. And I think that's one of the things that I had to learn. So we started from scratch. I think after the employed position, I did urgent care, and the urgent care was around local to where we started. And then my husband is currently a hospitalist with the closest hospital to us. And so that's actually how we were able to get started. We were known in the community. We had obviously been working employed for a few years before we started the practice. And like I said, he's currently still in the hospital and taking really good care of patients. And so people know us and want to come and be taken care of by us. The other thing is the local like urgent cares specialists in the area. So we get a lot of referrals. Where we are, the demand is high. So there are not a lot of primary care, private-owned primary care private practices, to be honest with you. I think with COVID, a lot of, and I hear some crazy number, it's not just local to where we are, but I think some like 11,000 practices closed down or something like that is what I heard. Don't quote me, but that's what I heard. And then the other stat that I heard was 30% of practices are physician owned. So it's definitely a trend. And like I said, it's difficult times. But okay, so to go back to the trajectory, we started from scratch. We were known in the community. We got better at selling and marketing. And then obviously it always starts with amazing service, which I think we're all trained to do that. So I don't think that that's an issue for the physician, community. We're well trained and we come into this with the heart of service. So that is number one. You want to serve well. Then the practice started, I think when we started, we were seeing, maybe the first day we had seen like 4 patients a day. And then in a few months, it was like 15 patients a day. And then now the physicians and providers in the practice, so the physicians, both me and my husband that are seeing patients, and we have a full panel. So, I mean, as in full panel, we use scribes just to keep us moving and efficient and all that. We have 2 nurse practitioners that are also working with us. We actually open 7 days a week. So it's Monday through Sunday, 9 to 5. And so we have full panels. So, I mean, there are days that we could see, 70 to 80 patients a day. We recently renovated. So we do have 11 rooms, because I think you were asking how many rooms we have in our practice. So I would say about 11 rooms. And then we're looking to open another location in the close future. I can't remember what other question you had, but we have an office administrator that helps to keep things straight. For the longest time, I was the administrator and I do not cover that job. So I gave it to someone else and she's doing an amazing job with that. And then I keep myself connected with other physicians. I keep my nose to the ground and I'm always reading, but I think that's physicians in general, right?
Yeah,
so
right.
So I don't only, study medical stuff. I study entrepreneurial stuff. I study practice management. And so that's the way to keep things moving.
So did you have to do a training in practice management, like a fellowship in that, or did you kind of learn, on the job?
It was training by fire.
Yeah.
So it was fun.
You
It
attend
was fun.
conferences, CMEs, or anything?
Yes, all of the above. So I did a length and breadth of conferences. I also, like I said, I got connected with other physicians. So I actually was part of some certifications, coaching programs, and things like that. So I actually tapped into those resources. And then I have accountability physicians, like I said, entrepreneurial physicians that are working together to learn how to run practices. Yeah.
That's awesome. That's really awesome. And so you mentioned, do you use mid-levels in your practice currently?
Yeah, so we do have 2 nurse practitioners. We are definitely hiring and, expanding. And so we are looking for part-time providers, both the nurse practitioners and PAs. And so the positions are that available like 2 to 3 days a week, and they'll be fully supported with designated MA and scribe, and also physicians as well as our NPs and PAs. So they're all doing a great job taking really great care of our patients.
So right now you guys are hiring for 2 part-time mid-levels and a physician position as well, or just a mid-level position?
Yes.
Okay.
Yes.
All right.
Absolutely.
And just because, someone may be listening and they're PGY3 and they're thinking, hey, there's something out here for me. Is this going to be a visa sponsoring position, a non-visa sponsoring position? How soon are you looking to recruit that physician?
I would say as soon as possible. I don't know much as far as the visa sponsoring. So I would say for right now, non-visa sponsoring. If there's a way to figure that out, I have no problems with that. Mm-hmm. But like I said, as of right now, it's non-visa sponsoring, but definitely looking for someone that is a great team player. Again, I feel like in the physician space, we are well trained trained and we do a great job taking care of our patients. So I'm not worried about the serve part of it. We, want to also compensate them well. And then the big one also is support, because I think that's the issue. A lot of, you've heard about a lot of burnout and things like that. So that's also kind of why I wanted to do it that way, where it was like a few days a week. And then the rest of the week you are home doing your own thing and you don't have to think about the practice. And while you're there, you're supported with the work, with the MA and the scribe.
Right. I think that's a really good deal, because having a scribe, I think that really reduces burden of paperwork in the office, and you can just focus on your patient. Obviously, you have to review your notes and sign them, but that's much easier than scribing and speaking to the patient and making a connection and ordering tests. So I think that's definitely a plus. So for those of you listening who are, going to be looking for jobs here soon, Apple Valley Family Medicine in Martinsburg, West Virginia, we'll have Dr. Ude's information as well in the show notes, so you'll be able to one click and get in contact with her. But I wanted to carry on with our conversation because there's another part of family medicine that I wanted to talk about. So when I look at applevalleyfamilymed.com, which is your website, I see that you offer several services, which we've touched on, a few of them: primary care, pediatric, women's health, sort of like the usual things that are associated with us as family physicians, right? Now, there's a lot more on there. You do aesthetic work, and you have a whole, menu of aesthetic services, from laser skin rejuvenation, laser hair removal, body sculpting, smart lipo, facials, Botox, and several different treatments. So, in the medical space, so many of us may have an interest in this, in family medicine, but we just feel a little bit like, well, we didn't do a Durham fellowship, or we didn't do what's the other one? I think, usually Durham fellowship or residency, I should say. And so how do we even get confident enough that we can offer such services? So can you share with us sort of like how you as a family physician got into aesthetics and what that looks like now?
Yeah. So when I was training, I got exposed to aesthetics and I really liked it because I do love using my hands. So it's, to be honest with you, with our medical training as physicians, we know way more than enough of the skin anatomy to do what we need to do. As you mentioned, there are NPs, PAs, advanced practice providers that are doing it. So we certainly can. The main thing is obviously to make sure that you're keeping up with what you're supposed to be learning. And there's certifications and organizations that you can get your certification from. And then what I did was, separate from the certification, was to connect with other physicians that were doing the procedures. And I connected with them, visit with them, and then obviously stayed abreast with all the webinars, and any opportunity I got to get trained, I did so. It's not easy, but it's totally doable. And I think we're well equipped. I think if you have a healthy dose of, making sure that you keep your patients safe, which I feel all physicians do, you should be able to dive in. Just make sure that you get the appropriate certifications to do so.
Absolutely. Absolutely. And I think, when I look back at it, it's, if we are presented with an anatomy lesson refresher on what we need to know, maybe for the face, or it wouldn't be as difficult as someone who maybe did not go to medical school or did not work on a cadaver at some point. So that definitely is good to know. Now, what would you say to the person who is in residency right now, maybe finishing out, and has that interest in aesthetics, but is just not sure how to start?
So get curious. There are organizations out there that, I know Umpire in New York does some training, and then the actual aesthetics has its own board. So usually with anything that you're interested in, even like practice management and stuff, they always have their organizations on board. So I would start there. And then it's always good to look around your area and find somebody that is doing what you want to do. And you would be very surprised, because people are afraid, oh, if I contact this person, they're not going to respond. You don't know that until you ask. And usually, people are willing to share, people are happy to talk to someone that is curious. And so I think that's your best bet, because then you can watch and see what they're doing, see what it entails. Because a lot of times you're, on the surface, this is what you think, but when you actually go in, watch the workflow, see, maybe the type of patients, the type of clients, the skills involved, then you get a better idea of what is needed. And then with the aesthetic space, the only caution I would give is it can be expensive when you go into like the machines and things that are used to provide the service. So I would say before you start investing in any equipment, you want to make sure that you
maybe evaluate the return on your investment.
Right. And start it first, because a lot of times, like, especially the reps that sell these machines, that's the only downside I would say. They just think, okay, physician, they have money. And if you're not careful, they'll have you buying 3 or 4 machines that you're not sure, you haven't even gotten the clientele yet. You know what I mean? So remember, I talked about sales and marketing, all that stuff, because I feel like the way we were trained, at least when I came out, I was like, I put my shingle up, people are just going to come. And what you find out is you give good service. If people don't know where you are and know who you are, they're not coming. So you have to, you know what I'm saying? You have to you have to start asking and putting your voice out there and all that. And then, so I would say things like Botox filler are usually not as expensive to get started. And it's one of those services that you can use the supplies and replace them, and it's not a financial burden as much. And then once you get that started and you build that clientele, then once you build enough, then you can get more equipment. But again, I'm pretty sure if you talk to somebody else that's doing that, then they will steer you in the right direction. So yeah.
Absolutely. Always good to seek mentorship or guidance before you even you may not like it when you go shadow someone for a day or two, and you may completely fall in love with it, and that's where you carry on. So always good to first seek out an opportunity to learn under someone that's already practicing in the way that you want to, like another family physician, and then determine how you're going to carry on from there. So I want to ask you a couple more questions before, as we start to round up on our conversation here. You've mentioned practice management a few times, and I remember very vaguely in residency, they would talk about practice management sometime in the third year. It'd come up here and there. And it was one of the core, I don't know if it was a core competency, or one of the areas that they tested us on when we did the boards. And it was like, oh, you could pick a practice management, section or something. And I remember not picking that. But tell us a little bit more, like break it down for us. What is practice management in the sense of a day-to-day life of a practice owner, family physician?
So on the flip side, I do not remember a thing from residency and training, not one, zero. So you were way ahead of me when I started. So, I mean, practice management to me is just efficiently running the practice. And there is a lot of stuff under that. And guess what? Medicine is the easiest part. Mm-hmm. That is the funny part. In medicine, I feel like we got that down packed. Is everything from marketing to get the patients to your door, to the staff. That's a big one, staffing. So we deal with a lot of people on the customer end, but you're also dealing with a lot of people on the staffing end. How do you pick the right people? How do you get them well trained? How do you make sure that they're giving amazing service to your patients? How do you make sure that that service is efficient? Do you want the patient door to door to be, less than an hour, or, whatever time frame you put on? How do you make sure that patients that are messaging with things, how does that work? Making sure that those calls and those messages are getting through. And then from checking the patient in all the way to triaging, to checkout, to scheduling a follow-up appointment, then to billing, coding and billing, right? Because just because you see 25 patients a day doesn't mean you're getting paid for 25 patients a day. You have to make sure that the patients are seen. You have to make sure that the notes are charted. You have to make sure that the right codes are put in. If you're undercoding, you're leaving money on the table. You have to make sure that your biller is doing a good job billing. Obviously, the insurance, and obviously, there's actually DPC where it's cash paying. So cash pay makes that billing easier. So that's another option. We're not cash paid currently, so we do insurance. So, working with our biller is very important. Are they putting the right codes in? and then, how much is coming back to us, how much is denied, things that go to collections. So it's all of that. When you get big enough, then you're most likely going to need an administrator to handle that. Because at one point I was, the clinician, the administrator, and the COO. My husband's the CEO. And so I was wearing 3 separate full-time job hats, plus a mom with school-age kids, 3 kids. And it was just like, so the other thing you have to learn to do is delegate. Oh my goodness. Because for us physicians, nobody can do it better. And it's for everybody. Like when you do stuff that is quality and well, you don't want to give it to anybody else. It's like, it's easier for me to do it, but I am so sorry. If that's the case, then you should be answering your phones and checking the patients in. So I had to learn that. I'm saying this from my personal experience. So I had to learn that I can't do everything. And so it was easier to the day-to-day stuff to let that go, but the actual practice management, it took me a minute to realize, look, I need to hire somebody for this. And then on top of that, just because you expect people to do stuff doesn't mean they do it. So people do what you inspect, not what you expect. So that's something I heard. So on top of that, you just have to, it's like managing a team it's something different. And if you do it right, it's very, very rewarding. But just like with anything else, it's a muscle. And that's also where communicating with other physicians and getting mentors that are doing what you want to do comes into play, because they've made all the mistakes and then they're passing that along to you. So yes.
Wow.
Yes.
No, that was so true, because I like what you said, people do what you inspect, not what you expect. I feel like that is so applicable across the board. Like, it's just amazing. We also noticed that you have a podcast of your own. Can you share with us about that and where our listeners can find you?
Sure. So my podcast was born because, I obviously take care of patients, and you get a lot of questions in a day-to-day. That's pretty much why you're seeing patients. They have questions for you. And so it just got to the point where I was like, I'm pretty sure there are a lot of people out there that have the same questions that my patients are asking me. And then I even have people that would, message me and things like that, asking questions. And so I was like, you know what? So my actual episodes are born from questions that my patients ask me. And I keep it really simple. It's usually medical topics. And I am, fortunate enough to be in contact with physicians that are willing to come on and give their expertise. And so depending on the topic, I usually have different specialists come on and shed some light on the topic. And so it's a weekly podcast. And so it's anywhere you can download podcast episodes, iTunes, Spotify. And the name of my podcast is Weekly Dose with Dr. Ude. So we've had it for close to a year now. And it's been really, 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 really good. And it's great networking. I love it. And it's great information for my patients and listeners.
That's awesome.
Yeah. And I'm sorry, I was going to say, to answer your other part of the question, how people can find me, our website for the practice, www.applevalleyfamilymed.com. And you can call us at 304-350-1087. Like I said, we're open 7 days a week. And we take in-person and virtual appointments. So if you're a patient looking for a quality family medicine physician, call us, look us up, and we'll be glad to help you.
Awesome. We will have your information, guys, so don't panic. Okay. Family.med.com. We'll have the link in the show notes. We'll have Dr. Ude's podcast also linked in the show notes, and all the resources I talked about, whether it's from the AFP or the ABFM, will be also listed in the show notes for you guys. So you can follow them on social media. You can contact, especially those of you who are looking for jobs. Okay. My PGY3s, this may be a great opportunity for you. You may want to look into it, especially if you have that inclination for diversifying your family medicine degree and really utilizing other aspects. Maybe you're more interested in primary care, in private and practice management, aesthetic services, and the like. This may be a great opportunity for you. So we'll have all Dr. Ude's information down in the show notes. Dr. Ude, before we leave you for today, can you give us your one mantra for success? What is the one thing that you tell yourself when the going gets tough or the tough gets going, whichever one comes first? How do you cope in those low moments, or how do you make it through?
That is a loaded question. I think simply do it scared. Do it messy. Just do it.
Yeah.
You know how they say, what is it? See one, do one, teach one. Get right to it. Just get to living.
Yeah.
You know, so just do it. And a lot of times it's the fear of not getting it right or the fear of making the wrong decision. I say if you get it wrong, then at least you know and you can pivot. But if you wait and do nothing, then you don't move forward. And stay connected, get mentors, get mentees, but do it messy, do it scared, talk to other people, especially somebody that is doing what you already has successfully done what you're trying to do, even if you have to pay for it. Because a lot of the rooms, because that's what I did, a lot of the rooms where these conversations are happening, sometimes you have to pay to get in, but it's an investment in yourself. Oh, and self-development. We read a lot of medical stuff, but read about everything, anything you have a question about, somebody that figured it out wrote a book about it.
Yeah.
So read as well. But I'm talking to physicians, so I'm pretty sure we read anyway. So
no, I think I did not read a personal development book probably throughout my time in residency, if I'm not mistaken. And then probably when I finished, I started saying, oh, I'm going to pick it up. But then you get into this habit of you can buy the books, but you're not really studying through them. And so until you get to the point where you're intentional about it, you can have many books and have never studied them either. So it's just
a tip in there is Audible. Listen, that's what I've been doing now because I'm so busy now. The physical book, even though I want to read, I can't get to it. But I read in my car. So everywhere I'm driving that's when I read. And when I'm home, it's the kids. So you can do it.
Yeah, no, absolutely. I'm a fan of Audible. Definitely a fan. Well, it was a pleasure to have you on the show today. We're so happy to hear your story and to really be inspired about our options in family medicine, our options in private practice, and our options being different and not always following the norm and doing whatever, not necessarily whatever we want to do, but following how we are trained, maximizing our training and our degree and our medical knowledge to the utmost capability. So really enjoyed having you on.
Thank you. And I was going to put a plug in. Actually, we can do whatever. I think that's where I'm in my life right now, is figuring out what you actually truly want to do and finding that person that has done it and do it. So the training as physicians is the springboard, and then whatever we want to do.
Yeah, absolutely. No, I'm with you 100% on that. Everything is possible.
Absolutely. Thank you so much. This was so good.
Look at you. I'm so proud of you for listening until the very end. And because of that, you deserve a reward. And I want you to go right now to drninaloom.com and download any of my free ebooks, whether it's for electives or clinical rotations, or even just whatever trials come your way as you navigate your IMG journey. Stay tuned for another episode coming up next.